The silent warnings your body sends before a stroke. A physician's desk guide. Every single year, roughly 15 million people worldwide suffer a stroke. That means someone, somewhere in the world, has a stroke every 2 seconds. But here's what most people never realize. A stroke rarely comes completely out of nowhere. It isn't a random lightning strike with no warning. In many cases, the body begins sending quiet distress signals days beforehand. Sometimes those signals appear even earlier. The problem isn't that your body stays silent. The problem is that most people don't know how to recognize the signs. We explain them away as stress, or a bad night's sleep, or simply getting older. By the time the emergency finally happens, those early warnings have often been ignored for days. Today, you'll learn what your body may be trying to tell you before a stroke. More importantly, you'll learn exactly what to do when a real stroke is happening. Those first few minutes can make the difference between recovery and permanent disability. Before we discuss the warning signs, let's understand what a stroke actually is. Picture your brain as a busy city. Every neighborhood depends on a constant delivery of oxygen and nutrients. Your blood vessels are the highways that keep everything running. Every second of every day, blood flows through this network without interruption. A stroke happens when that transportation system suddenly fails. There are 2 main types of stroke. The first is called a hemorrhagic stroke. This happens when a blood vessel ruptures inside the brain. Blood leaks into surrounding brain tissue. Although less common, this type is often extremely severe. Today, however, we're focusing on the more common form. It's called an ischemic stroke. You may also hear it called a cerebral infarction. This type accounts for roughly 80% of all strokes. An ischemic stroke happens when a blood clot blocks a major artery supplying the brain. Once the blockage forms, brain cells lose their oxygen supply. Without oxygen, those brain cells begin dying within minutes. That's why doctors often repeat one simple phrase: time is brain. Every minute matters. The sooner blood flow is restored, the more brain tissue can be saved. Here's the encouraging news. Ischemic strokes are often highly treatable when recognized early enough. Doctors call this the golden treatment window. The faster treatment begins, the better the chances of recovery. Researchers are also studying something equally important. Many patients experience subtle warning signs before the stroke actually occurs. These early symptoms may appear while the underlying blood vessel problem is still developing. Recognizing those signs may provide a valuable opportunity to seek medical care before permanent brain damage occurs. That's why understanding these early warnings could truly save a life. Before we talk about the subtle warning signs, there's something even more important. It's something you should memorize today, because one day it could save someone's life. If you ever think that you, or someone near you, is having a stroke, remember one simple word: FAST. F stands for face. Ask the person to smile. Does one side of the face droop? Does it move differently from the other side? A stands for arm. Ask them to raise both arms straight out in front of them. Can they keep both arms up? Or does one arm slowly drift downward? Stands for speech. Ask them to repeat a simple sentence. Is their speech slurred? Does it sound unusual? Is it difficult for them to speak clearly? T stands for time. Call emergency services immediately. Don't wait 10 minutes. Don't wait to see if it gets better. Don't drive them somewhere yourself unless there's absolutely no other option. Every second matters. During a stroke, brain cells die minute by minute. The faster treatment begins, the greater the chance of recovery. If you remember only one thing from this entire video, remember this word: FAST. It remains the most trusted and widely recommended tool for recognizing a stroke. Everyone should know it, not just people who believe they're at high risk. Many stroke organizations now recommend an expanded version called Be Fast. It adds 2 more warning signs that are just as important. B stands for balance. Watch for a sudden loss of balance or an unexpected loss of coordination. E stands for eyes. Look for sudden blurred vision, double vision, or a sudden loss of sight in one or both eyes. These symptoms can be especially important. Some strokes affect the back of the brain. Those strokes may not be detected by the original FAST test alone. That's why many healthcare professionals now recommend remembering be fast instead of fast. Now that you know what to do during a stroke, let's talk about something that may happen even earlier. The warning signs your body may send days before the emergency begins. Before we look at those early warning signs, there's one important question. Who should pay the closest attention? The truth is that anyone can have a stroke, but some people carry a much higher risk than others. High blood pressure remains the #1 controllable risk factor worldwide. The dangerous part is that it often causes no symptoms. For years, it can quietly damage blood vessels throughout the body, including the blood vessels inside the brain. Another major risk factor is atrial fibrillation. This is an irregular heart rhythm. It allows blood to pool inside the heart. That blood can form clots. Those clots may then travel directly to the brain. Diabetes also increases stroke risk. So does high cholesterol. Smoking is another major contributor. Obesity adds even more risk. A sedentary lifestyle can make these problems even worse. These risk factors rarely work alone. More often, they combine and reinforce one another. Age also plays an important role. Stroke becomes more common as people grow older. But there's an important trend to understand. Doctors are seeing more strokes in younger adults than ever before, even people in their 30s and 40s. Many of these cases are linked to undiagnosed high blood pressure or previously unnoticed heart conditions. Family history matters too. If a parent or sibling experienced a stroke, especially at a younger age, your own risk may be higher. That's something worth discussing with your doctor. Even if you feel completely healthy today, none of this is meant to frighten you. It's meant to help you understand your personal level of risk. The signs we're about to discuss deserve more attention if you already have one or more of these risk factors. The goal isn't panic. The goal is awareness, because recognizing a warning sign early may give you the opportunity to act before permanent damage occurs. Before we continue, there's something important you should understand. The signs we're about to discuss are not a diagnostic checklist. They are not a substitute for the FAST or be fast test, and they should never replace a medical evaluation. Some of these symptoms are subtle. Others overlap with common conditions that have nothing to do with stroke. That includes heart disease, lung disease, and several other medical problems. What they all have in common is this: none of these symptoms should simply be ignored, especially if more than one appears at the same time, or if you already have known risk factors, such as high blood pressure, high cholesterol, diabetes, or a family history of stroke. Everyone feels tired from time to time. That's not what we're talking about here. Some people describe a very different kind of fatigue before a stroke. It's overwhelming, heavy, persistent, and it doesn't improve even after a full night's sleep. One possible explanation is reduced blood flow. As blood vessels become narrowed, the heart has to work harder. Its job is to keep the brain supplied with oxygen. That extra effort may leave the rest of the body feeling exhausted. If you suddenly struggle to complete everyday activities, and that exhaustion feels completely different from your normal level of fatigue, don't ignore it. It's worth discussing with your doctor, especially if it appears alongside other warning signs. Most people associate chest pain with heart problems, and that's understandable. But the heart and the brain are closely connected. They share the same vascular system. Problems affecting one part of that system can sometimes affect the other. Some studies of stroke prodrome, the early symptoms that may appear before a stroke, have reported chest discomfort in a number of patients. That discomfort may feel like pressure, a burning sensation, or a heavy ache across the chest. Whether it's related to a stroke or not, chest pain should never be ignored. It always deserves prompt medical evaluation. Pay attention if your legs, ankles, or feet suddenly become swollen. Doctors call this edema. It often means that fluid or blood is collecting where it shouldn't. One common reason is that the heart is no longer pumping efficiently. Now combine that with another symptom, an unusual need to sleep during the day. If these two signs appear together, they may suggest that your circulatory system is under stress, from the heart all the way to the brain. That doesn't automatically mean a stroke is coming, but it does mean your body deserves medical attention. Don't simply assume it's normal. Now pay especially close attention to the next warning sign, because this is one that many people dismiss, even people who consider themselves healthy. This isn't the brief lightheaded feeling you get after standing up too quickly. This is something much more intense. The room may suddenly feel like it's spinning. You may lose your sense of balance or feel completely disoriented without warning. One possible explanation is reduced blood flow to the brainstem. The brainstem plays a major role in balance and coordination. If you suddenly become clumsy, lose coordination, or experience severe vertigo that feels completely out of the ordinary, treat it as a neurological warning sign. Don't wait for it to disappear on its own. Seek medical evaluation as soon as possible. Your heart and lungs are designed to work together. Normally, they function in a steady rhythm. When circulation becomes impaired, that rhythm can begin to break down. You may become short of breath after very little activity. Even climbing one flight of stairs may suddenly feel difficult. Or you may wake up during the night struggling to breathe. Whatever the cause turns out to be, changes like these should never be ignored. Your body is telling you that something isn't working the way it should, and that deserves prompt medical attention. This may be the most misleading symptom on the entire list, because it often looks like nothing more than a common cold. You may experience chills, general weakness, or a persistent cough. But there's one detail that changes everything. If that cough produces pink, frothy mucus, treat it as a medical emergency. Pink, frothy sputum is often associated with fluid building up inside the lungs. That can happen when the heart is no longer pumping effectively, whether the cause is a stroke, heart failure, or another serious medical condition. It requires immediate medical attention. This is never a symptom to simply sleep off. When in doubt, get evaluated immediately. So how can you lower your risk, starting today? The good news is that many stroke risk factors can be improved, and even small changes can make a meaningful difference over time. First, get moving. You don't need to run a marathon. You don't need an expensive gym membership. Even a brisk walk for 30 minutes, most days of the week, can improve your vascular health. Regular physical activity helps your heart pump more efficiently. It helps control blood pressure. It improves circulation. And over time, it lowers your overall risk of stroke. Second, pay attention to what you're feeding your blood vessels. A healthy diet isn't about perfection. It's about consistency. Foods rich in potassium, vitamin E, and omega-3 fatty acids have all been associated with healthier blood vessels. Think about adding more leafy greens, beets, almonds, walnuts, and fatty fish like salmon. No single food can prevent a stroke. There is no magic ingredient, but healthy eating patterns, repeated day after day, can make a real difference over the years. Finally, take your overall health seriously. Manage stress whenever possible. Protect your sleep. And don't skip your regular medical checkups. Conditions like high blood pressure, high cholesterol, and diabetes often cause very few symptoms in their early stages. But left untreated, they quietly damage blood vessels for years. Keeping these conditions under good medical control is one of the most effective ways to reduce your long-term risk of stroke. It's not just routine maintenance. It's an investment in your future health. A stroke doesn't have to feel like an unpredictable disaster that arrives without warning. In many cases, your body may already be trying to tell you that something isn't right. The challenge is learning how to recognize those signals, instead of explaining them away, or convincing yourself they'll disappear on their own. Paying attention today could help prevent a medical emergency tomorrow, and that knowledge doesn't just protect you, it can also protect the people you love. If you, or someone close to you, has been experiencing several of these warning signs, especially more than one at the same time, don't wait. Talk with a healthcare professional. Get evaluated. It's always better to discover that everything is fine than to discover a serious problem after it's too late. If you found this video helpful, please consider supporting the channel, like this video, subscribe to Physician's Desk Guide, and share it with someone you care about. You never know whose life that information might one day protect. Stay informed, stay healthy, and we'll see you in the next video. Take care of the body that carries you through every day. You only get one. And sometimes, it's been trying to warn you long before you realize it. This video is intended for general educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek guidance from a qualified healthcare professional if you have questions about your health. If you believe that you or someone else is having a stroke, call your local emergency services immediately. Do not wait for symptoms to improve. Early treatment can save brain function, and it can save lives.